The White House estimates roughly 900,000 children ages 5 to 11 have now received their first COVID shot. Top health officials call that a very strong start to the next phase of America's vaccination effort.
Parents and families across the country are breathing giant sighs of relief, and we are just getting started. We will continue to work with governors, local leaders, healthcare providers, and others to build on this progress.
The White House says around 700,000 more kids have appointments scheduled to get vaccinated. The CDC authorized Pfizer's shot for 5 to 11-year-olds last week. Nationwide, 28 million kids in that age group are now eligible for their first dose. Studies show many parents say they're eager to get their children vaccinated, especially ahead of the holidays. But some experts warn demand could start to drop off in the coming weeks. Dr. Ven Gupta now, lung doctor, NBC News contributor, and faculty member at the University of Washington. Doctor, thanks. You know, for months, many have said that this age group, 5 to 11, is key to ending the pandemic. Well, that's happening. So are we almost there at the end?
Good evening, Shep. Great to see you. We're not there quite yet. 10,000 of our fellow citizens, Shep, week over week, well into these coming winter months, are going to still die, we suspect, based on forecasts from the University of Washington, from this virus. So how we define the end of this pandemic probably is going to be in terms of daily and weekly death tolls. We're not there yet. I suspect for all your viewers out there, end of March of 2022, once we're past cold and flu season, once hopefully we're past the worst of COVID, that's truly the light at the end of the tunnel.
You know, some school districts are starting to roll back the mask requirements. Medically, is that the right move?
I think it's too early to start rolling it back at this moment, and yet we need an off-ramp away from masks. That's what people are craving, normalcy. So we need a science-based way to think about that. When you look dispassionately at the data, Shep, here's what it says. It clearly shows that if you're otherwise without serious medical conditions, less than 65, and you get a breakthrough illness, if you're that rare individual, it's not a big deal. You might have mild symptoms at worst. There's interesting data, Shep, now suggesting out of the Netherlands that even if you do test positive, your risk of transmission, say to an unvaccinated child at home, is also extremely low. So that's what normalcy looks like, getting more of us vaccinated. So vaccine breakthrough illness is not a big deal. That's what endemicity looks like. We're headed there. We're not quite there yet.
You know, we have researchers watching the data every place around the country every day. And what they're seeing in California is a bit concerning. When you see what's happening there, what's your take about for all the rest of us?
You know, this is what I'll say, Shep. I mean, there are spots where cases are climbing, and yet there is no specific spot here where hospitals are overwhelmed at this moment. I will say 10,000 weekly deaths week over week and across the country. We're still very much in this pandemic for the next 3 to 4 months. So that's why we still need to remain vigilant, get the unvaccinated vaccinated. And yet, Shep, to your point earlier, for us as public health officials, as messengers to remain credible with the American people, we need to be clear about what an off-ramp looks like. When can we start really donning off masks? When can we really regain normalcy truly? In my view, that's probably end of March of 2022. But if we're going to say we're going to lead with the science, we need to start providing that off-ramp now so people feel like they can trust us.
Yeah. You know, one more thing. In the Deep South, vaccination numbers are low. We all know that. There's a different way of handling it down there. You know, different people handle this different ways. But down south, it's going to be cold in another month or so, and people are going to be indoors. Vaccination rates are low. How worried about you or about Mississippi, Louisiana, and some others?
Extremely worried, Shep. I mean, 80% of the deaths that I keep citing that we're going to accrue over the next 4 months will be happening in states like Mississippi, Alabama, Georgia, states that have counties where full vaccination rates are less than 50%. So those are going to be the states that are going to get hard hit yet again. They got hard hit in July, August. It's going to happen again December, January, February.
Talk to your doctor. Do what's right. Dr. Gupta, thank you.